receiving prescription medications this Saturday from 10 to 2. It's really important to do this. So many Americans have become addicted to the medicines in their medicine cabinets. So getting those medicines out, properly disposing them is critical.
How many deal with opioid-related incidents?
We deal with normally certainly much greater than 20 or 30 or 40 calls per day.
So the war on drugs is not really working. I think we've done a shell game, we've displaced it, and I think so many times our programs, as good as they are, they focus on the symptoms, of it would be like a cancer. We're treating symptoms instead of going after that.
We're gathered together today to address America's drug and opioid crisis, and a crisis it is.
However, it's about 108,000 people die every year from overdoses, primarily driven by illegal fentanyl.
Doctors over-prescribing. They have to be careful.
The war on drugs in America has been going on since the 1960s with no clear end. Mississippi has been suffering from the drug misuse and addiction since the beginning and has not been giving much financial aid by the national government. The National Drug Control budget is $459 million, with only $1.3 million going to Mississippi.
As a person who, advocates, of course, for my home state, as well as prevention, treatment, and recovery and harm reduction efforts, the goal is for Mississippi to have an increase in funds. But what we're focusing on is using the funds that we have available to make sure that there are efforts to help curb the opioid crisis.
Without sufficient funds, there's not much that Mississippi can do to combat the ever-increasing drug problem. To make matters worse, the state of Mississippi only has around 7,000 police officers, so the war on drugs is a major uphill battle.
Wow, so just like everywhere else in the nation, it is definitely affecting the state of Mississippi. The opioid crisis began here in the 1990s. And if you look at the most recent data, which is from 2023, it shows that 2.9 million people, that's our population here in Mississippi. And of that 2.9 million people in Mississippi, 2.27 prescription drugs were dispensed in 2023. So that's roughly 6,200 prescriptions a day.
Overdoses in people under the age of 35 increased by 158% since 2019. Schedule II drugs include raw opium, codeine, morphine, oxycodone, fentanyl, meth, and amphetamines, and penalties for simple possession of Schedule I or II drugs range from a misdemeanor to a 20-year felony. Even with ever harsher sentences, drug use and drug dealing are growing because of how easy it is to acquire substances that can be abused.
Now I'm dealing a lot with child abuse, child custody, child support, divorce type issues. Not necessarily somebody that was brought into court as a result of drug use, but drug use affects something that I'm making a decision on. I do see a lot of veterans that have fallen off and started misusing opioids that they were previously prescribed.
Combat exposure, deployment, post-traumatic stress disorder, and the unique culture of the military can be challenging, and many veterans turn to unhealthy drinking and substance misuse to cope with these stressors. People struggling with mental illness are also likely to abuse their drugs. Those struggling with mental illness will abuse their prescribed drugs or illegal drugs to ease their pain.
Sure. So drugs can impact the community in various ways, taking into consideration many factors, but what I would like to draw attention to is that if a person suffers from substance use disorder, it can affect their health. They can become sick, as well as suffer from diseases that can lead to impacting their family, health care, also their jobs, because if a person is sick or has a disease, then that means that they may be absent from work, and that will cause the employer to have to either replace the individual, or they will be short-staffed.
Right. So what I'm doing is a lot of the times making a determination on child custody. and drug usage by one or both of the parents is an issue that pops up in my court. And a lot of times the drug usage of one of the spouses is what's broken up the marriage in the first place.
Even with all the laws put in place to stop the spread of drugs, more and more demoralized people are being addicted to drugs every year in my community due to the ignorance of the national government and even the local government. So, Mr. President, with the opioid crisis devastating many small communities like Jackson, Mississippi that build America, why does the federal government give billions of dollars for international issues but leave the state and local governments underfunded in addressing these domestic issues that are slowly rotting the families and infrastructure of your country? How many more lives must be lost before we see accountability and action to fix the infrastructure of our beautiful nation?